to the Breast Cancer Awareness and Breast Care Workshop. My name is Abigail Morakinyo, and I am a registered nurse. I'm also the founder of Health in Check Academy, which is an online digital space that brings women together from all over the globe. And basically, it's a platform that serves to educate and empower women to basically maximize their health. I'm also a, I hate the word expert, so I don't call myself a weight loss expert. I'm simply someone who used to have excess weight, and as a result of that, I got type 2 diabetes. Now, for me, what I had to do was I had to basically retrace my steps and think about what was the root cause. So it wasn't just about dealing with the symptoms, but it was dealing with the root cause. And I was able to trace my steps back, and I was able to reverse my type 2 diabetes and bring my weight down to what is acceptable for my body, you know? So in that respect, I help women as well who are struggling or who are on the journey. They don't quite know, you know, there's so much information. They don't quite know how to go about losing weight in a safe manner, okay? So that's me in a nutshell. The purpose of this workshop for me is about educating women. And the thing is, we live in a world where there is so much information. We are the information-rich generation, yet diseases are so prevalent. Yeah, we've got type 2 diabetes, which is so prevalent in the Black community. We've got high blood pressure, again, so prevalent in the Black community. Now we have another giant, which is the C word, cancer. And everybody at that name, people are like, oh, they dread it because, you know, it's almost like a death sentence, you know. But the thing is, unlike other cancers, such as ovarian cancer, pancreatitis cancer, breast cancer can actually be detected early because unlike the other cancers, you have symptoms. So basically, you will have things that happen before you get the diagnosis. And tonight, that's what I want to do. I want to basically be able to educate you women to know what you should be looking for, okay? So that when you see something that is out of the norm, you can quickly report it or go to your health practitioner. So welcome, ladies. Welcome to the Breast Cancer Awareness and Breast Care Workshop. I have a special guest with me tonight, and she's going to be sharing a little bit about bra fitting and breast care. Okay, so please stay tuned for that. The workshop is for an hour and a half. I will try and keep to time. We start 7:30. And I'm hoping to finish my part from 8 o'clock. Then from 8 o'clock, we're going to have Charity who will do her part. Then at the end, if you have questions, we will do our best to answer that. Okay, so ladies, let's get into it. Let's go. I'm going to start sharing my screen now. Welcome again to everybody who has joined. So basically, you're all wondering, what is breast cancer? I know most of you, or you know, it may not be the case, but I know most of you may have been either, or you may know people who have had breast cancer or some form of cancer. You may not have people, you know, that you're related to, but I think, you know, most of us have had experience, but do we really know what it is? Right, cool. So now, what is breast cancer? Breast cancer basically is when you have cells which basically cluster together, it forms a tumor. Now, the thing is, the body is made up of cells, right? And on a daily basis, you know, we're producing cells, regenerating, we shed, and then we get new cells as well. But with cancer, what happens is you have this cluster of cells which basically have turned, or, you know, against the body. So it's turned against itself, it forms a cluster, and it's that cluster, the medical term for it is a tumor. Basically, you have two types of tumor. There's a benign tumor, and benign basically means it's non-cancerous. So in general, most benign tumors are harmless, okay? However, on the other hand, you have what's known as a malignant tumor. Now, the malignant tumor are the ones that are more serious. These are the ones that have the potential to become cancer. Okay, so in other words, they need to be removed. Okay, so basically that's what breast cancer is. And with this diagram, you can see the what's it called, the different basically, if you're going to perform a breast self-check, these are what you should be looking out for. The first one, where it says a lump or pain in your armpit. Now, the thing is, you know that with women, our breast is not only made up of fatty tissues, it's also made up of different glands as well. So yes, it's normal to have some swelling. And the time that, you know, there's particular times in our lives that we'll experience it. Sometimes it's due to hormonal changes, sometimes it's due to menopause, and then the more obvious one as well is the monthly cycle. So during the time of the month, we tend to get swelling anyway in the breast area. You may even find that sometimes you've got like little lumps and bumps around the armpit area. So if you're going to be checking your breast, the best time to do it is about 3 days after your last period. Yeah, so don't check your breast during your period, because you're going to get swelling and tenderness anyway. So the best time to do it is when you're not on your period. And what you're looking for is, if you look at the first diagram with a little red mark around the armpit area, what you're looking for is any swelling under the armpit. Okay, if you find that, sometimes the lump might be painless. So again, people think, okay, it's not painful, I just ignore it. But for me, what I say is, if it's a new lump, if it's something that you've not had before, you've not experienced it before, the best thing to do is to go and get it checked out, or to speak to a health professional. It could be nothing, but it's always better to report any new changes. If you look at the second diagram, you've got what's it called, like a little something coming out from the nipples. Now, if you're not a breastfeeding mother, you shouldn't be having any discharge from your nipples, okay? So if you are, after having a shower, if you find that, if you squeeze your nipples, or even just voluntary, you're getting like a discharge from the nipples, that again is something for you to look out for and report, okay? This is not normal. You're not breastfeeding, so you shouldn't be having any discharge from your nipples. The third diagram shows inflammation or rash around the nipples. So sometimes you may find the odd spot, okay? What I say is, the more you check your breast, the more you'll be familiar with it. And then the quicker you'll be able to recognize any changes. So just around the nipples, you can see that there's like a ring. So always look out around the nipples. Are you having any rashes? Is there any discoloration or anything around the nipples, okay? Now, if you go down to the bottom left, you can see the next diagram, and it shows any changes in the size or the shape of your breast. Now, ladies, we all have different breast shape, okay? Different sizes, okay? And I don't know if you have experienced this, but sometimes your left feet may be slightly bigger than the right feet, yeah? It's the same with the breast as well. Some breasts tend to sit lower than the other. Sometimes you might even have one breast that's slightly bigger than the other one, okay? Now that in itself is not a problem. However, like I said, the more familiar you are with your breast, then the quicker you'll be able to recognize any changes. And the obvious change is if you've got a breast that's actually obviously and overtly bigger in size than the other one, particularly if it's something that is new as well, okay? So always look out for the shape, a change in shape or size of the breast. The following diagram, it shows you the texture of the skin. Feel, that's where I talk about the TLC, and the T is for touching. Okay, you need to touch your breast, okay? And what you're feeling for, and I will describe it once I stop screen sharing, but the only thing I can use to kind of like basically illustrate this is if you feel an orange, like a normal orange, if you feel the skin of it, now that texture is similar to someone that has, early signs of breast cancer. Because what happens is a particular area of the breast starts getting thicker. So the skin around that breast starts getting thicker. You might even get a discoloration as well. For women who are Caucasian, that discoloration tends to be a little bit more red, okay? For black skin, again, you will see a difference in the color, okay? You will notice that that color might either be slightly darker than the rest of, than the normal skin, your normal skin color. Okay, so always look out for signs or changes in the texture and the color as well of the skin. And then the last one is a lump or thickening in the breast. Now, for women who have had breast cancer, one of the things that they describe the lump as is it feels like the size of an egg. Surprisingly, like I said at the beginning, with cancer, it's like a cluster. So it's a tumor. It's almost like a big ball, and that ball is sitting underneath the skin. Yeah, but however, with breast cancer, you can actually feel the lump. So you may not be able to feel the whole lump, but you certainly will be able to. There will be some protrusion. So you are able to palpate a lump. So when women say, "Okay, I don't know what I'm supposed to be feeling for," because your breast is quite lumpy anyway. Because don't forget, like I said, it's made up of a lot of fatty tissue, a lot of glands as well. Yeah, but the lump is very, very obvious. So it's very, very important that you look and you touch, okay? Right, so now we want to know, what are the risk factors for breast cancer? Now, as with most things, there's risk factors, for everything. Even something as simple as crossing the road, you have to be aware of the risk factors of crossing the road, okay? But now let's come back to breast cancer. With breast cancer, unfortunately, there are some risks that is out of our control, okay? Now, what do I mean by risk factors that are out of our control? Well, if you have a look at the slide here, the first risk factor is age. Now, unfortunately, the older we get, the more the chances increase of getting breast cancer or any form of cancer, okay? So with age comes that risk. So we can't help getting older. And that is why at the age of, I think in the UK, it's about the age of 50, if I'm not mistaken, you automatically get invited for a mammogram, okay? And that basically is a breast screen, okay? So as you get older, the chances increase. So that really is out of our control. Then another risk factor is family history. Now, if some of you have been to the GP and you've been asked this question, for example, it could be that maybe you went, your blood pressure was a little bit high. And one of the questions that they will ask is, do you have anybody in the family with high blood pressure? Okay, so that suggests that family history plays a significant part. Now, that's not to say that if you've got, for example, let's say a parent or a sibling had breast cancer, it doesn't automatically mean that you also get it. But what it just means is that you are predisposed to also getting it, because it's with medicine, they say that sometimes these things might be genetic, okay? So again, family history is another risk factor of breast cancer. Now, another risk factor is medical history as well, okay? So medical history could be like, if you've had a history of other chronic diseases, you also increase your chances, because what happens is your immune system is basically weakened, okay? Now with cancer, basically the cells are, it's so ravaging that if you have a low immune system, you can be susceptible. Okay, so medical history plays a part. And lastly, it's about gender, okay? So Although, this is an interesting fact, although men, men are likely to get, what's it called? They're not exempt. Some men actually do get breast cancer, okay? However, being a woman increases your chances of getting breast cancer. And that's because with men, their breast, basically, it doesn't form. Yeah, you don't often see men with big breasts. It's just literally, they have a chest with nipples stuck to it, okay? Only in certain and very rare cases will you have men with breasts. Now, back to the matter. Women, we have breast tissues, and we have, a lot of fat, and we also have a lot of glands as well. And then also, we have this hormone that is called estrogen. So basically, because of the high amount of estrogen that we have, that increases our chances of developing breast cancer, okay? So these are basically the risk factors which we can't control. So now we're going to move on to the factors that we can control, okay? So what is in our control? Well, one of it is weight. We can control our weight. Now, sometimes it might be difficult, and I know we have a lot of struggles with weight, like I said, because of hormones, because of the lifestyle that we're living, particularly in this season. I mean, we can't all deny that this has been a very challenging year. So our stress levels could have been, shooting up and down, up and down. And with stress comes about the hormone cortisol. And cortisol is a stress hormone. And that hormone is one of the things that is responsible for women's weight yo-yoing and shooting up. Okay, so weight, as much as possible, I always advise women to maintain basically to maintain a weight that, one, is proportionate to your height, and then after, you can work on maintaining it. Okay, there is no ideal body. When you look at another woman and you think, oh, I would love to be as slim as her, I say, no, be slim that suits your own structure. Okay, it's unrealistic to attain someone else's weight or someone else's body type, because we all have different body shapes, we all have different structures. Okay, so maintain the weight that you're comfortable in. Yeah. Another factor as well that is within our control is our physical activity. Yes, we live busy lifestyles. Some of us, we even work sedentary jobs. And I know even now with the whole COVID situation, majority of the women would have been working from home. So that means that you're possibly sitting down for like long periods at a time. But always try and schedule in either a 10-minute walk. Start with a 10-minute walk. Even if it's a 10-minute walk that you can do every single day, do it. If you can do something that is consistent, it's much better than maybe saying, oh, I walk for 30 minutes once a week. It's better for you to do consistent, have consistent patterns than for you to just do things, as and when. So yes, living a more active lifestyle will significantly reduce your risk factors. Another one as well is alcohol consumption. Now, I don't like to assume. I personally, I don't drink, okay? But however, I know there are some people who do drink. And what I always say is, be realistic. If you know that you are a drinker, you need to start thinking about reducing the amount that you drink. Because first of all, alcohol, and you can Google this, but it's a well-known fact that alcohol consumption increases the chances of getting cancer, particularly for women, by over 50%. Now that is a high percentage, from this alcohol. And alcohol as well, people might say, okay, well, I don't drink alcohol. That's fine. But there are other things as well that you consume that increases your chances as well, such as carbonated drinks, So it's better to try and replace these things with much more, more healthful drinks, such as herbal teas, different kind of like, fruit teas. So yeah, alcohol consumption. And then lastly, environment. A lot of people will argue that, well, actually with environment, you can't control that. But actually I say you can, okay? Now, my environment, when I think about my home environment, I've made it such that it actually enables me, it encourages me to basically want to be healthy. If I don't have it at home, I'm not going to eat it. Okay, my environment is such that I make sure that when I come in, when I've had a really stressful day outside, there's somewhere for me to actually pour out and release it, you know. So be aware of your environment. Your environment also is about your friends, your family. Who are you allowing into your space? You know, so you have to make sure that things that you can control as much as possible, you are, you know, religiously trying to work on those things. Because like I said, it will make up for the things that you can't control.
Nico, how do you feel about the claims?
Being overweight is associated with increased risk of breast cancer, especially for women, because if you have a lot more fat tissue, then you are increasing the amount of estrogen that your body releases. And this is one of the main causes or things that can increase your chances of breast cancer. Now, moving on quickly. If you're living a very, very busy lifestyle, you don't have to worry. Just as you would you wake up in the morning and you brush your teeth, you spend what, 4 or 5 minutes brushing your teeth, and you do that like almost robotically without even thinking, is the same way that you can do breast check, okay? And I've come up with these 3 things, which is TLC. Give yourself some TLC, you know, it could be start off maybe every month, then when you're comfortable, you may not even need to do it every month. It could be every 3 months, quarterly, whatever. But do 3 checks, the TLC, which is touch and feel your breast. Like I said, don't do it after a period. Don't do it during your menstrual cycle, 3 days after a period, so that everything settles. You're not having any hormonal or any lumps there. You touch, have a touch. Can you feel anything underneath the skin? And you have to press quite firmly, okay? And look in the mirror. So the best thing to do is stand in front of a mirror with your hands behind the back of your head and have a look at your breast. Just have a look. Is there any changes in the color? Is there any changes in the size, shape? Is there any changes in the nipple? Has the nipple gone inside? They call that inverted nipples, yeah? And then check and, you know, look, is there anything that is untoward? And when you find that, don't panic, because some of these things, they're nothing to be worried about, but leave that to the doctors to have a check, a thorough check, an examination to put your mind at ease, okay? So that is the end of that slide. Like I said, the questions we will keep until after the workshop. So by 8:30, we'll break out and have a Q&A session.